When your kids have a sniff of a cold with maybe symptoms of coughing, sore throat, not eating, naturally as a parent you want them to get better and quickly. Or as an adult, you might need to go back to work the next day. And in many cases you're thinking that treatment is antibiotics. But before you ask the doctor for antibiotics or grab it over the counter, depending on which country that you live in, why not stop and think? Does yourself or your child really need antibiotics? Does antibiotics cause more harm than good? Here are 8 reasons you should not take or give antibiotics to a child without seeking doctor's advice. %80 of colds are due to viral infection. This means that cold symptoms are caused by a virus, which in 80% of cases resolves on their own without antibiotics. Antibiotics do not kill viruses, only bacteria. So what they might do is reduce the duration of your symptoms by 16 to 24 hours. So antibiotics would not work if it's a viral infection. You can check out the links in my description below for the difference between viral and bacterial infections. Saying antibiotics can cause other types of infections such as oral thrush or vaginal thrush in females. This is because they disrupt the normal environment, encouraging the growth of yeast. I have also seen penile thrush in men who've had few courses of antibiotics, and this was discovered on semen sample. If you already had yeast due to other reasons, taking antibiotics might just make it worse. By taking antibiotics, you're suppressing your body's natural immune response to fighting infection. In fact, not all bacterial infections need antibiotics. Some can be treated naturally, like urinary tract infections, which you can check out in one of my videos, or bacterial vaginosis. Antibiotics have side effects such as diarrhea, vomiting, stomach pains, and can also cause serious allergic reactions such as hives, difficulty breathing, and chest tightness. Saying antibiotics can also cause serious but rare side effects such as rupture of the Achilles tendon or a nasty bug that causes severe diarrhea known as C. difficile, especially in those taking long-term or frequent antibiotics. Antibiotics also come in the form of ear drops that can cause permanent deafness or tinnitus if taken for longer than the recommended duration. Studies have shown that children who had antibiotics over a period of time later had bowel problems such as irritable bowel syndrome in adulthood. This could be because some antibiotics, especially the broad-spectrum antibiotics, do not differentiate between good and bad bacteria, killing all in its path. So bad bacteria could be responsible for your symptoms of bloating, stomach cramps, and diarrhea. I always advise women and children especially to take probiotics after a course of strong antibiotics to help replenish the depleted stores of good bacteria such as lactobacillus. Antibiotics, if used commonly or frequently, can cause antibiotic resistance. This means that the bacteria now mutates to survive the effect of the antibiotics. Hence, the antibiotics that used to work for your chest or infection no longer works. And this can also apply to people taking antibiotics for the first time because the bacteria has already mutated. Because the doctor said so. If your doctor feels that you or your child does not need antibiotics, then you should listen, and usually your doctor would advise you to come back if symptoms do not improve within a time period, depending on the nature of the infection. For instance, most ear infections improve within 7 days. So if by day 4 you know better, then you might need antibiotics. Actually, I wanted to find 10 reasons why you should not take antibiotics, but antibiotics are actually not that bad if used for the right reasons. And as we know, millions of lives have been saved since penicillin has been invented. However, there is a reason why antibiotics are not sold over the counter, especially in the UK, and this is to encourage people to visit the doctor to ensure they're getting the right treatment, and that might not always be antibiotics. For more useful video on knowing your health, please share, like, and subscribe to my channel.